Today I'm going to talk about the Gummy smile. How could we make a friend with Gummy smile rather than as an enemy? So my presentation, I have no conflict of interest to take care of my presentation. As you have seen on my slides, for a smile, there are several kinds of smile, like in class 1, class 2, class 3. We all have different kind of smile. But no matter what the smile is, there are basically three components of that. The first one was the lip. How does the lip look like? How much the upper or lower teeth show? And then how much the gingiva display, which are very important to compose of our smile. But in terms of the Gummy smile, I think we do see more Gummy smile in class 1 or class 2 patients, but much less in class 3 or in an aging phase. And now that we know that because of development of the test, to treat a Gummy smile could be much easier than treating an inadequate upper incisor display without Gummy smile. But today in my presentation, I am not only showing you how we can treat Gummy smile, but also the question will be what the others will be. For example, how is the face looks like, how is the lips looks like after we intrude or extrude the upper or lower incisors. Let me give you two examples at the beginning for two Gummy smile patients and how do they change after I intrude the upper anterior teeth. So now we have a 19 years ago young girl whose chief complaint was sticking out upper front teeth and also Gummy smile. As you can see from the slides, she also got an occlusal can as well and uneven gingiva display when she smiles. And also the chin, because of lip incontinence, and looks like the chin throat length is quite short. And on the examination of the combing CT, as you can see, she actually is a class 2 maxilla protrusion and mandibular retrognathum and asymmetry. And you can see clearly the occlusal can and the chin deviation. Intraorally, she got a class 2 molar occlusion and procline upper incisors, excessive objects, and obviously a narrow upper and lower dental arches. So my plan for her was I would like to remove 4 first bicuspids, and at the same time, when I'm retracting the upper anterior teeth, I would like to use taste in upper to intrude the upper anterior teeth so that I can decrease the amount of Gummy smile. So these are my appliances and mechanics that I'm using for the upper incisor intrusion and retraction. So you can see I use a basal arch wire, which is stainless steel wire, and then I use nitrile coil to do anterior retraction. And then from the taste, I have an intrusive spring, lever arms, to do anterior teeth intrusion while I am retracting the upper anterior teeth. So 9 months of the space closure, you can see most of the upper and lower space were almost being closed. And you can see the improvement of the overbites and the overjets. And also I achieved a class 1 macro occlusion. And then at the same time, when I look at the patient, I think I raised her profile and face looked nice, but when she smiled, I think I decreased the Gummy smile too much because I intrude the upper incisor too much. And now the upper incisor display even has only 2/3 of the crown display. So I don't think this is a good smile for a 19 years old girl. A good smile for her age should have full crown display with 2 millimeter gingiva display. That would be a useful smile For me, this is a little bit older smile for her age. So what I did was I removed the intrusive lip arms in upper so that I want to let the upper incisor relapse, actuate again by themselves. And at the same time, I would like to keep intruding the lower incisors because I would like to decrease the upper incisor display as good as possible to give her a useful smile. So overall, I spent 1 year and 5 months to complete the treatment. In terms of occlusion, overbite, overjet, I think that was pretty good. And let's check the progress changes of her face. You can see at the beginning of the treatment, she got a gummy smile, uneven occlusal can. And during the treatment, I over into the upper incisors. So then the smile became age smile instead of a youthful smile. But in the end, I think she had a very good smile, useful smile, with full crown of upper incisor display, with 1 to 2 millimeter of gingiva display. But when she is not smile, look at the lips. You can see at the beginning, the upper lip and lower lip thickness is quite thick. In the middle of the treatment, it's a bit thinner than before. And then in the end of the treatment, you can see in comparison to the original upper lip and lower lip thickness, you can tell the upper lip and lower lip thickness actually decreased. But anyway, her lips were thick before. So I decreased a little bit, which is not too much for her to affect her useful facial appearances. So the later view, you can see the improvement of her lip posture. And also when she closed the lip, there were no metallic strands, and also the chin throat length and chin projection increased for that. And three-dimensional superimposition, you can see the main change were retraction of upper and lower lip, and also intrusion and retraction of the upper and lower anterior teeth. So from this case, although this case is still young, and the decrease of the upper lip thickness decreased not that much to give her a Asian face, but here we have to be aware that when you are decreasing gummy smile, might accompany with decrease of the upper lip thickness. Let me give you another example, which is 27 years old, which is a little bit older than the former patient. Her cheek complaint was sticking out upper front teeth and gummy smile. So you can tell the gummy smile was too much for her. She got a lip incontinence, metallic strands, and CT scan examination showing that she was a class 2 with maxillary protrusion and excessive maxillary dental area high development. Intraorally, you can see a class 2 buccal occlusion, lower anterior carotid, and number 16 missing. My decision for her treatment plan was I would like to remove number 14, number 25, number 34, and number 44. And then at the same time, I gonna use upper taste to improve her gummy smile. So this is a mechanism very similar to the first patient. So basically, I was using the taste to have an anterior intrusion of upper anterior teeth. But unfortunately, the upper taste dislodged, and on the left side, I have to use a forceps in order to help for the improvement of the dental midline because the missing of the number 16. And I keep going for a couple more months, and until 21 months, you can see the upper space closure was almost complete, and I was keep on upper and dental midline correction with the forceps on the left side. And at this moment, I check her face. Okay, you can see now, her upper lip and lower lip actually became thinner than before, but still not too bad yet. But since she's still having gummy smile, excessive gummy smile, so I made a decision to say, yes, I would like to decrease the gummy smile a little bit more. So I put the upper left test back there, not only for the more intrusion of the upper anterior teeth, but also for helping improvement of the upper dental midline. So overall, actually, I spent 3 years and 4 months to treat her and get a acceptable, decent occlusion. Let's check her smile. Before the treatment, during the treatment, and in the end of the treatment. I think I did a good job to give her a useful smile with a full upper incisor display and also have few gingiva display, which gives her a very good useful smile, what should be like her age. But when she is not smiling, you can see the upper and lower lip thickness actually decrease gradually until the end of the treatment. I think her upper lip was too thin for her age to read young. So for me, like a very thin upper lip means that it's an aging phase, which is no good for the patient. Although the patient have a good smile, but in the end, when the patient is not smile, she might be older than her age. So because when we are doing retraction and intrusion of the anterior teeth, we're usually going to have a lip veneer border roll in, which result in a thinner upper lip thickness, no matter it's upper or lower. And for the facial profile, you can see the progress improvement of the lip incompetence, chin projection especially, but also you can see the progress decrease the upper lip fullness as well. So when I check the superimposition, you can see the main change of her was retraction of the upper and lower lips, and also retracting of the upper anterior teeth as well. So let's have a comparison of these two patients. When we finish the patient, one is around 20 years old, another one was around 30 years old. You can see, although their smile, I do believe the smile both are quite good, and I like them very much, and looks like quite a useful smile. But when they will not smile, you can tell, yeah, the upper one is 20, the lower one could be more 30, because the upper lip thinning after the treatment. So let me put the superimpose all together. The upper row is the younger one. The lower row is the older one. You can see the amount of upper lip and lower lip retraction, they were similar. The amount of the upper anterior teeth retraction and intrusion, both of them, they are quite similar as well, but they end up with a different thickness of the upper lips. So from here, you have to be very careful because the age differences. When we are treating gummy smile, for an older patient, we have to be very careful. We cannot intrude the upper incisors for the patient. And fortunately, 6 months after, when the second patient, she came back for me to follow-up exam, you can see there's a little bit relapse of the gummy smile 6 months after, which for me, I believe she was more useful smile for me. And when she is not smile, you can see the upper lip thickness actually came back and improved after that relapse. So that relapse actually really helps me to bring the youth back to the patient. Again, the lateral profile, you can see the facial convexity because she got an upward rotation of the mandible, which gives her a more chin projection. And because the relapse of the intrusion, the mandible actually went back a little bit so that she ended up with a more convex facial profile. Gives her a more facial convexity, which gives her a younger and useful facial appearances. So let me summarize my first two patients. Will be avoid excessive intrusion and retraction of the upper anterior teeth in young class 1 or class 2 patients for a proper upper incisor display, gummy smile, lip thickness and a useful facial appearances. So what I learned from this patient, the lesson will be, yes, by extrusion of the upper and the teeth and increase the facial convexity, we may be able to give a patient a useful facial appearances. So how we can extrude the upper and the teeth? That we can use two tests in upper between canine and the first premolar. And then after that, we can use a pair of extruding spring. I make it from 17 by 25 TMA wire and I bend it that way so that I can do maxillary total arch extrusion. To increase the facial convexity, we can use bi-razor to reposition the mandible downward and backwards to increase the vertical dimension, to increase the facial convexity, and at the same time using intermaxillary elastic to bring the bite to bite together. So let me give you two class 3 patients as an example. This is a 33 years old female patient who wished to have a smaller chin and a better smile. So you can see her upper lip thickness is actually quite average, and the chin throat length for her is a bit long, and basically it's a straight facial profile and looks like class 3 for Asian population. Intraorally, you can see a class 3 buccal occlusion, anterior crossbite, upper and lower moderate anterior crowding. So my plan for her, because the first aim for class 3 patient will be, I want to increase the facial convexity. So the first step I'm going to do for her will be use bi-razor with intermaxillary elastic in order to increase the facial convexity. So you can see immediately after I use bi-razor, the facial convexity actually increased and she look better now with a increase of the upper inside the display and also the upper lip thickness also increased a little bit. So then when I'm using the bi-razor and the intermaxillary elastic, I also apply the open coil between upper canine and upper first premolar in order to open a little space before I put the tails between them and at the same time apply the extruding spring. So back and forth for several times of the treatment. Before I debone the patient, I remove the bi-razor, I remove the spring, and let the bite and the mandible to settle down at least 4 months until I see a stable result. So in the end, I almost spent 2.5 years to establish a class 1 occlusion and good overbite object without tooth extraction. And look at the changes of her smile and at the rest. You can see that was a big improvement, a big and good useful smile for her age, and also the increase of the facial convexity so that she looked younger than before the treatment. This is another example, even older now, 37 years of female, have very similar chip complaint. She prefers a smaller chin. Intraorally, you see anterior crossbite, crowding, and class 3 buccal occlusion. So again, the first aim for this patient will be to increase the facial convexity. So apply the bi-razor and intermaxillary elastic. So after that, immediately after that, you can see the increase of the upper incisor display and also the increase of the facial convexity. And interestingly, you can see also the chin deviation also was improved. And in the lower dental arch, I use two tests in the lower so that I can do lower total arch distalization in order to improve the object. And at the same time, I also was using a upper extruding label arms to extrude more for the upper anterior teeth. And in the end of the treatment, I spent 1 year and 10 months achieve a class 1 buccal occlusion and good overbite and object. And you can see the change of her smile and how much the upper incisor display after the treatment, and also a little bit of around 0.5 to 1 millimeter of gingival display, and also the chin deviation was improved. So was a very interesting finding for me. So actually we did a study to look at for those class 3 patients who had BioRazor for the treatment of their class 3 malocclusion and class 3 phase. So we had a 14 patient in our control group who had no extrusion of the upper dentition, had no BioRazor for their treatment. Another 16 patients who had extrusion of the upper teeth and also using BioRazor to increase their facial convexity. So we had a measurement of the changes of the mandibular position, backward and downwards. And also at the same time, we measure the T1 and T2 upper and lower lip, three-dimensional lip surfaces to see the changes of the lip thickness. So this is the first result. You can see there's an increase of the facial convexity in the experimental group after the treatment. And also you can see the upper lip surface area increase, and also the mandible was repositioned backwards and downward in the experimental group. So this is one of the example, including in our experimental group. You can see the changes of her upper lip thickness after treatment and the changes of her smile after the treatment. So let me summarize number 2 for you is to increase facial convexity and upper incisor or gingival display or upper lip thickness for a useful facial appearances in class 3 patients. So in class 3 patients, if you will prefer a useful facial appearances and smile, and you have to increase the facial convexity and increase the upper incisor display and gingival display. Next, let's talk about aging phase. Now we have a 47 years old female patient who was referred from Korea for the continuity of her anterior open bite treatment. So you can see when her smile, the upper incisor display is not good enough, although she got an open bite. So the aim of this treatment, I was aimed to increase the upper incisor display because she got a very good thickness of her upper lower lip and the facial convexity was there. So I won't like to change it. So intraorally, you can see one side was class 3, the other side was class 2, and there's a denominator discrepancy between upper and lower because of the chin deviation to the left. So the primary aim for this patient then wasn't to increase the facial convexity, but to increase the upper incisor display. So at the beginning, I put the upper case between canine and the premolar to increase the upper incisor display by using extruding spring. And at the same time, I also use BioRazors. But the purpose of the BioRazor isn't for the increase of facial convexity. That was for the correction and improvement of the chin deviation. So overall, I spent 1 year and 9 months to achieve a good overbite object and the buccal occlusion, and the dental midline discrepancy was improved. And then look at her smile before the treatment, during the treatment, and in the end of the treatment. You can see a useful smile with smile arc, a better upper incisor and gingival display when she smiles. And when she is not smile, you can see in the end actually her upper lip thickness increased a little bit, which is good for her to have a useful facial appearances. For the lateral profile, the facial convexity and the chin projection actually were similar. So this is the for aging phase that you don't want to have an upward rotation of the mandible in order to improve the anterior open bite, since that will decrease the facial convexity. So instead, for this kind of patient, that we have to extrude the upper dentition in order to keep the facial convexity so that we will not worsen their facial appearances. The last patient will be a 47 years old class 3 female. So you can see her face with or without smile. They're always like, the Asian face because of class 3. And intraorally, you can see multiple missing teeth and the prosthesis as well. So there were not too many teeth that I can use for her treatment, which could be quite difficult cases. So because of the facial convexity, so the first aim for this patient, of course, is to increase her facial convexity. So the first step will be to put on the bi-razor and put on intermaxillary elastics. So you can see immediately after I put in the bi-razors, her face changed already. The front had classic profile into another kind of profile, and which was younger and with a bimax protrusion. So for the lower, I used lower taste to do total arch digitalization to increase to help to decrease the objects. And after treating her for 1 year, I think her face now looks younger than before. After 1 year of the treatment, you can see more upper inside the display now, much less lower inside the display. But since the patient is still complaining, hey, my lips, I don't like my lip because it's still too much protrusive for me. But I say, no, you have to be careful that when we are retracting your upper teeth, that you may look older. But she insisted, no, I don't like my lips. Then I have to bring the upper and lower teeth back more. So I use upper and lower teeth now together to bring the upper and lower teeth back more in order to improve the protrusive lips. So overall, I spent 3 years on this patient, and let's look at her change of her face. Is it before, during, and after the treatment? I think her face was much more useful for me. These are useful facial appearances instead of aging face appearances for me now. You can see the increase of the upper inside the display and the decrease of the lower inside the display. And when she's not smile, you can see the upper lip thickness eventually will increase after the treatment. So that also helped to improve the aging face appearances for this patient. The later profile, because during she didn't like her lips, so we bring back a little bit so that her chin projection increased a little bit more. But overall, before and after treatment, the facial the facial convexity actually increased. So overall, in the end, I will like my conclusion for how we can make a friend with Gummy Smile instead as an enemy. So for younger patients, class 1, class 2, avoid excessive intrusion and intrusion of the upper and teeth. In young class 1 or class 2 patients, for a proper upper incisor display, Gummy Smile, lip thickness, and a useful facial appearances. Increased facial convexity, upper incisor display, gingival display, upper incisor lips for a useful facial appearances in class 3 or aging face. So if you ask me if Gummy Smile is a friend or is an enemy, I would say it's a friend most of the time. And we have to make them as our good friend to make our patient roots younger and useful. Thank you very much.